Good morning. My name is Helen Oniobos, student from Mississippi Women University and Tupelo. I'm in Tupelo branch. Today we're going to talk. About why we use antibody, when to use antibody and when not to use antibody. That's going to be our topic. We simply continue to use the antibody. Continuation of using antibody will cause resistance, which means when we use the antibody all the time, we don't need it. Like we have a cold, we sneezing, we have influenza. Then we take antibody, it gets to a stage our body get used to it, then resistant. It's not going to be. It won't work when you have a bacterial infection. Many studies have shown that antibodies are often used which they are not needed. People use antibody. Oh, I have a headache. Let me go get some antibody. Let me go to my doctor to prescribe, or my care provider, the nurse practitioner to give me antibody. Now, it's not going to work. When you take antibody for so long time, then when you have bacterial infection, take antibody, it's not going to work at that time, which means it's going to cause a resistance. Antibiotics, they save life, but overuse of the antibody causes side effects and can lead to antibody resistance. Proper use of antibody. What is antibody resistant? Antibody resistance is the ability of a bacteria to resist that side effect. So an antibody that is that kills bacteria, when you use it for so long time, instead of killing the bacteria are going to be multiplying. More bacteria is going to be coming in. Antibody resistance is one of the world's most pressing public health illness that we once easily treatable, but now antibody become more difficult to treat those bacteria because of our continuation of using antibody when we don't need it. People just go to their primary care physician that, oh, I have a headache. Is there any way you could prescribe the vancomycin for me, or cycling? They tell you the name because they're used to using the antibody frequently. So most of them knows the name of what they want when they go to the doctor. Okay, and in the hospital, most of the time when they come to the hospital, instead of doing like, if you have you sick, you went to the hospital, they're gonna give you antibody. Instead of them do like blood culture, drawing your blood, see what is going on inside, the blood, the type of antibodies that are going to kill it. They're just going to say, oh, start this antibody, start the vancomycin, start the zosine. So by the time they start the antibody already before they draw the blood, so what is going in there is already killed. So when they find what is in the system, in the blood, by the time they try to use the same antibody, you're going to resist away. Then they're going to try to get another type of antibody. It costs a lot of money for the insurance, for the hospital, for the patient that is coming in. However, bacteria are increasingly resistant to antibody, which means that common antibody may not get rid of infection caused by those resistant germs. Also, when the doctor or your healthcare provider prescribe antibody for you, make sure you take everything. Even if you are getting better, finish the dose. Don't say, oh, okay, I'm feeling better, I'm not going to take it no more. Or I miss a dose, let me double dose myself. No, don't double dose yourself. If you remember, as soon as you remember, go take it. Don't wait until the next morning. Oh, I didn't take it yesterday, so let me take a 1,000 milligram instead of the 5, like they prescribe 500 milligram 3 times a day. Don't go back to it. That's okay. Let me take a 1,000 instead of the 500 I'm supposed to take. And when you finish, you have to finish those doses. If you don't finish it, don't keep it aside that, oh, when next time I feel sick, then I'm gonna go take it. Most of the people do that. They go, oh, okay, I took they prescribed 60 tablets for me. I took 30 tablets already, 3 times a day. I took 2 tablets or half of the bottle already. The 30 they prescribed. I took 15 already. I'm feeling better. I'm not gonna take more. I'm just gonna go keep it. So next time when I feel sick again, I'm sneezing or I had a cold, then I'm gonna go take it. No, we don't use antibody for cold. We don't use antibody for sneezing. We don't use antibody for runny nose or cough. Those are just virus that are going to take its course. We do have things, sneezing, coughing, influenza. All you're going to do, you just take some fluid, hydrate yourself. You will take like Tylenol if you're having headache for the cold. Take some fluid, hydrate yourself, rest, then let it take its course. Don't run to your primary care physician or care provider that, oh, prescribe antibody for me. Push, don't push your provider. Overuse of the antibody also could have consequences, including C. diff. It's a type of bacteria that, due to a lot of use of antibody, when you have that C. diff, you're going to have diarrhea, tenderness, abdominal tenderness, pain. Sometimes when some people have the C. diff, it takes a long time to wear off. You're going to be having diarrhea, and the diarrhea is going to be inconvenient for you. So it's due to excess of antibody resistance cause that problem also. Like I said, you can't take no antibody for common cold, flu, bronchitis, sore throat, unless if the sore throat is caused by strep. Like some people have sore throat that is caused by strep. When they find, the only way they're going to find out that you have that type of sore throat, they have to do a culture. You have to go to the doctor's office. They do a culture, they find out that it's a strep. Then you could take antibody for that, but not just sore throat. That you have a sore throat, then you need antibody. Like I said, to the public, most of the people, they don't know that antibody is a medication. It's only treated infection, not virus, and the misuse of antibody has contributed to growing of antibody resistance. And even in food, they use antibody for food. Like the chicken we eat, the pigs, the cow, they use antibody for the growth. That's antibody growth. So when even if you eat those type of antibody, if you eat those type of pigs that they use antibody for, you're gonna get the same symptom too, like you're taking antibodies. So that's why you be careful when you go to this grocery store to get some chicken. Sometimes they say natural chicken, no antibody, no steroid, because the steroid also is an antibody. No antibody, no steroid. Look for those type of organic, food. Okay. So one of the questions I'm just going to ask: do we use? Is it true or false that we could use antibody for sneezing or cold or
that is false.
Okay, okay, you're right. Okay, for 3 things that we don't use the antibody for, there's another type of infection again that is going around. Though we have it in our hands and in our body, but when it causes when it has infection, that's the serious that they call it MRSA. Like the MRSA, everybody has it in the hand. We have MRSA, but when it causes from bacteria, that's where we get concerned about it. The MRSA is an antibody to the cause of the MRSA is overuse of antibiotics too. So when we use antibiotics too much, it could cause the MRSA. And once you have the MRSA, the only medication that could take up that is vancomycin. And right now they see that vancomycin, the MRSA is kind of resistant to the vancomycin right now. So we have to be careful the way we use antibody. Don't use antibody when you run to your doctor that I'm constipated. Can I get some antibody? Or I'm having diarrhea. Can I have antibody? No, you can't use no antibody for diarrhea or cold. Like I said, yeah, like cold. You can just rest.
So what would we take if we did have diarrhea?
If we have diarrhea, you have to. Yeah, if we have diarrhea, for example, people have diarrhea. Like now, this C. diff diarrhea, you could go to your doctor. Probably give you Imodium. Imodium for the loose too. So they could just give you like, I take Imodium after you have a loose too. You could take like a capsule, or some of them come in a tablet, but it's not an antibody. That one is just like something to hold down the stool, to taking the stool, so it will come just rushing like, because the MRSA, when you have the diarrhea of the MRSA, it's not pleasant.
And what about for headaches? Like, what should we take for headaches since we cannot take antibiotics?
Oh, you could take just Tylenol.
Tylenol?
Mm-hmm.
Okay.
I advise my patient when they come to the hospital, say, oh, I'm having headache. I would say, okay, I'm going to let the doctor know if we don't have no TD, you don't have no prescription of Tylenol, I'll, call and get order for Tylenol for you.
Okay.
Anybody has a question? Don't you? No. So you don't have no question? Do you have a question, sir?
So, like, we cannot take another person. So if our friend had antibiotics and it's the same type, they have the same infection we got, we still cannot take their medication?
No, sir. Sir, you can't. You can't take it because you don't know the type of infection he has. So taking, I just say you can't take someone's antibody and you can't reuse the leftover. So you can't take your friend's antibody, sir.
So, like, okay, I had an infection one time, and, like, I was on antibiotics, and I started to feel better. So I had stopped taking it just because I felt better. I didn't feel like I needed to keep taking it because I felt better. So that wasn't right?
No, it was not right, sir. You like I just said, you can't take antibody. When you feel sick, although you're getting better, you still gonna finish the dose, the prescription. That if it's steady tablet, if it's capsule, you have to finish it, sir. Finish it. While in the process of taking the antibody, make sure you drink a lot of water, and take a good rest. Yes, ma'am. Yes, ma'am.
Well, I like to sleep a lot, and so if I supposed to, like if I miss it today, can I just go and take it tomorrow?
No, ma'am.
No?
No, you can't take it tomorrow. You skip that dose already, so you're just gonna take the dose you're supposed to take for that day.
Oh, okay.
So
Yes,
don't
ma'am.
double up.
Yeah. And you don't double dose yourself also. If it's 500 milligram, 250 milligram, the doctor wants you to take 3 times a day. If you miss a dose, your third dose at night, because you were sleeping, don't take it. Just skip that dose and start the next day
Oh, okay.
and take the 250 milligram.
All right.
Any question? Okay. Any further question? Any questions, sir? Any question, ma'am?
No, ma'am. Thank
Any
you.
question? Okay. Okay. Did you guys, learn anything from what we just said? Because, okay, I have one question. This question gonna go to Mr. Sidney right there. Can you tell me three viruses that you can use antibody for? 3.
I remember you saying you cannot use it for the common cold.
Okay.
You cannot use it for, like, if I have a sore throat.
Okay.
And, like, if I start sneezing or if I have itchy eyes, you said that I cannot use it.
Correct. That's good.
All right. Thank you so much.
Okay.